All right. So Sam Khozin is a healthcare entrepreneur and former internal medicine resident who develops innovative claims analytics software while actively seeking to acquire and revitalize struggling rural hospitals. He specializes in collaborative decision making processes and communication techniques drawn from high stakes negotiation, with a focus on removing artificial barriers that prevent healthcare teams from delivering optimal patient care. Sam mentors healthcare professionals in career transitions and is passionate about creating transparent, physician led healthcare environments. Sam, I'm looking forward to hearing what you have to share.
Thanks, Denise. I appreciate that. So, what I'm all about and my company is all about is really transforming hospitals and rebuilding trust with the patients, with us. There's a crisis today because it all comes down to patient care. And again, because we're all patients, it impacts all of us. So, if any one of us had a loved one in the hospital today, would we neatly trust they're receiving the most effective, safest, and most compassionate care possible, especially without going broke? So currently, the field has a lot of misaligned incentives, which cause staff burnout. When I talk with doctors, they feel like they're just RVU machines, just there to, in essence, collect the RVUs and as many as they can. And because the administration or the way that the hospitals run or their circumstances around the hospital really kind of mandate that they do that, or I feel that way. Patient experience kind of becomes an afterthought in this environment. And there's always a sense of financial urgency. And that takes precedent over care quality. So my partners and I, our mission is to operate and transform hospitals into national leaders in quality of care, infections, medical mistakes, patient and staff experience, and access to and affordability of care. When it comes to rural hospitals, especially, many of them are vital to their communities, and their decline is often preventable. So our goal is to really help stabilize and revitalize these institutions to help them thrive and help their communities thrive. We operate on three fronts. We level the playing field for hospitals with a rapid payer audit, in essence, where we look at 12 months worth of claims, and it takes us just about a day to really turn that around. And we're able to show the hospitals they're denied and underpaid claims all in one place under different reports. And also we tell them what they can do about them. So it's not just, hey, here's a list of claims, good luck. It's actually, hey, here are some actionable ways you can modify these claims to actually resubmit them and get paid. We also provide hospital operations consulting. And our ultimate goal is to acquire hospitals, or at the very least, we don't have to necessarily acquire them. Our goal is to operate them, which in many cases might mean acquisition. When we are looking at acquiring hospitals, we're looking to acquire those who are either at the risk of closing or are closed already, or just standing empty. Why are we looking to do that? Well, we want to create the best damn healthcare system anyone's ever seen, because we're all patients. And you might be asking, okay, well, there's a lot of different people buying hospitals out there. What separates you from anyone else? Our goal is to focus on quality and experience. So to do that, we want to overhaul the clinical processes and culture that kind of permeate the current environment. There's no transparency currently. A lot of hospitals in general are very opaque, and hospital decision making is also pretty opaque. So we want to kind of open that up and make it more transparent and collaborative, as well as decentralize the decision making and kind of provide more power to the doctors and nurses and staff who are on the front lines. To do that, we're also giving them tools like theory of constraints, Lean, and Six Sigma, as well as a flattened organizational structure to make it all possible. In addition to all those things, we're also looking to use our software to eliminate denied and underpaid claims, to provide more revenue for the hospitals, and instill a culture of collaboration with active listening, empathy, and compassion. So what we need from the community is, if you know of hospitals that are open to new ownership before they're forced to close, or before they get into a crisis where they don't see a way out, we can help them at the very least increase their revenue by getting them lowering their AER from some of them are like months or half a year. We can lower that AER to just weeks and get them more cash flow, as well as get them all help them recover their denied and underpaid claims. We're also looking for healthcare professionals who are aligned with our collaborative model, and investors who would want to help be part of a healthcare system that we're trying to build with purchasing hospitals, and especially those who take a longer view on return on investment and aren't just doing it to make profit, but are actually bought into making healthcare for everyone better. We're also happy to meet operational experts in theory of constraints and similar fields, and those who are willing to learn those techniques. What I can offer is a platform to talk about what you're passionate about. If you're a healthcare leader, a hospital leader who wants to spread the word about what you're doing at your hospital or organization to help change the healthcare system or strengthen the community where you are, I'd love to have you on my podcast and talk about that. I can also provide mentorship for healthcare professionals in transition, communication and negotiation training with things like the Black Swan communication method, and also talk about techniques to enhance team dynamics and patient care. Thank you so much. Well, I'm an entrepreneur who happens to be a doctor, and my overall goal is to help transform healthcare